All right, we're just at the 5 minute mark, so we'll go ahead and kick off our webinar today on patient engagement innovation at free clinics. My name is Cecilia. I'm one of the co-founders and chief strategy officer here at CareMessage. Unfortunately, Ariana from the National Association of Free and Charitable Clinics was not able to join us today. She had a last minute issue with a medical thing, not critical, but not able to join us, and so. We'll go ahead and just kick this off on the CareMessage side, but very grateful to our partnership with the NAFC. I know many of you are members of the association, and so we just continue to find innovative ways that we can help tell the story of free clinics and the incredible work that each of you do within your communities and for the nation. So I'm going to kick us off with just some background on myself for those of you who do not know me. Again, I'm Cecilia. I'm one of the co-founders and chief strategy officer here at CareMessage. My work here at CareMessage is really driven by a lot of my own personal experiences and lived experiences. My family came to the US from Mexico when I was one, with nothing but the clothes we were wearing. And as we were rebuilding in this country, we really struggled financially to make ends meet. I represented a lot of the lived experiences of the patients that you serve. My family actually received care at a free clinic in South Texas called El Milagro. That's where we used to go for care, as well as our local community health center. And so I was just very lucky as I was getting into high school, found my way into an early college program that eventually introduced me to the STEM fields and tech. And I ended up going to Stanford University, where I studied product design, engineering, and first learned about the concept of human-centered design. I, at the time, also learned a lot about the lack of representation of women and minorities in technical fields. And so I thought my career was going to be in engineering and in engineering education. And I went to graduate school and started a PhD program in mechanical engineering with that as a focus. But unfortunately, the first year I was in graduate school, my dad, who you see in these photos, passed away from prostate cancer. And that really made me reevaluate what I was doing. And I felt this sense of urgency to do something meaningful for my community. And at the time, my co-founder Vineet had been working on this idea for CareMessage for about a year. They didn't quite have a product yet, but they had this idea of how can we leverage text messaging in particular as a way to drive in communication between healthcare organizations and patients. And that came from his own experiences. He was on medical school and was working at a free clinic, one of the free clinics associated with Stanford, and was using his phone to get in touch with patients and realized how powerful that was as a mode of communication to get patients back into care. But a platform didn't quite exist that was bridging those needs on the patient side with those of the clinics. And that's really where the idea for CareMessage came. And this was in 2013. So we've been doing this work now for a bit over a decade now and continue to grow and expand our impact. But unfortunately, as we get into the why of CareMessage, and we won't spend a lot of time here because I want to get to the data piece, but a lot of the why we exist hasn't changed very much. Nationally, we spend a lot in healthcare for worse life expectancy rates, and this is even greater. We see greater disparities for low-income populations where they're living 10 to 15 years less than higher income populations. And a lot of time, the technologies that are being developed to really help correct for a lot of these problems are not necessarily designed with these populations in mind, and that unfortunately is helping potentially widen, a digital divide that's ultimately impacting health equity and health outcomes for these populations. And so we center all our work on leveraging technology to help improve health equity. And for us, the how is just as important as why and what we do. And so we build technology, and very critical to that is who's designing that technology. And so we try to bring a lot of members into our team that have those lived experiences that your patients face or that you face as staff and volunteers at free clinics. And then the how is we are a nonprofit like a lot of you. And so for us, this work that we're doing is really to try to drive improvements in outcomes ultimately and have an impact on the communities that we serve, and less on your traditional for-profit tech companies that are just trying to drive revenue for the sake of revenue. And that has enabled us to really grow and scale nationally. We've been in this work since 2013. Over the last decade or so, we've reached over 20 million unique patients nationally. We serve close to 200 free and charitable clinics all across the United States. It's about half of our customer base, the other half being comprised of community health centers And our newer market is our tribal health organizations as well. And we see health equity as three different pillars as we've defined them. It all starts with increasing access to care, and that's how we think of sort of systems work. How do we make healthcare accessible? How do we bring patients into primary care? How do we look at affordability, health insurance, Medicaid, those other aspects that impact somebody's ability to access care? And then we look at clinical outcomes as the breadth of areas that you all tackle, from prevention to screening to incidence rates of chronic diseases and cancer and other areas, and how are we really driving improvements in outcomes, both in the short and the long term. And then the last piece that's so critical for low-income populations is social drivers of health, all these non-medical needs that patients have, like food and housing and transportation, that oftentimes impact our ability to actually drive improvements for them. And so this brings us to one of the most exciting projects I've been able to work on in my time here at CareMessage, which is looking at the aggregate of the data. There's a lot of really interesting things that are happening across our organizations. And now that we've grown to work with over 400 organizations nationally, we actively engage with about 6 million patients on an annual basis. And that's through over 80 million different interactions between messages going out, messages coming in. We're in 45 US states and territories, and about 200 of those organizations we serve are free and charitable clinics. So it starts to pose a very interesting both data and impact question. And so as we were looking at our national data, we then started to think about what does it look like to segment and carve out what's happening specifically within free and charitable clinics. And so within those 80 million messages that are exchanged on the CareMessage platform, we have about 5 million of those messages that are being exchanged between free and charitable clinics and the populations that they serve. And surprisingly, or not surprisingly, about 86% of those messages are tied to one of those, our three health equity pillars. So you'll see that on the right-hand side, just the distribution of that. So again, we've got about 5 million messages. 4.3 million of those are directly aligned with our three pillars. Oftentimes what we leave out of the three pillars might be other type of ad hoc messaging or notifications or things that are not directly tied to something in these three categories, but a really great depth of impact that's happening within every interaction. And so this is what our national data look like in terms of what was included in this analysis. Out of our 200 or so organizations, 150 were included in this. That equated to a little close to 300,000 patients and those 5 million messages. And something that is new was new to CareMessage starting last year and has carried through this year and will continue into the future is the way that we're leveraging artificial intelligence to really understand and analyze the content and the interactions that are happening. As I mentioned earlier, across the CareMessage platform, we have about 80 million messages that are exchanged, and it's just not humanly possible for us to any one person or any group of people to really go in and review that interaction individually. And so last year we started to bring in a few different tools and ways that we're leveraging AI, both in inbound messages, and some of you that are CareMessage users, you see this in how we interpret inbound responses. And so even though you might send a question, you create a question on CareMessage and that question is set to be a yes or no question. Our AI response categorization will accept other variations of that and parse a patient's, sentence or paragraph into that categorization of a yes or a no. The intent of this response the patient sent might have been that yes or that no, or if you're sending a multiple choice question where you're asking a patient, text A for transportation, B for food. If a patient sends in a sentence and says, I need help with my car, the system will automatically map that to transportation versus things that are tied to food. And so we brought that in to help really with the inbound message parsing and ease a lot of the staff workflow, especially on reviewing individual responses, plus improving the patient experience because they're not getting, error messages about their response. And after we did it for the inbound messages, we moved on to the outbound messages and really trying to understand like what is happening, what are people messaging about, and how do we understand the breadth of things that are being communicated about across these clinics. That led us to earlier this year being able to really understand the differences in trending categories and start to see both national trends and then segmented trends across our different customer segments. And so we'd be able to see the various topics on, let's say, the area of clinical outcomes that are being sent out at free clinics or FQHCs or tribal health organizations, and starting to see any differences in the distribution or priorities of different topics. And then as we started to look at that, as we headed into the second quarter of this year, we realized there's a lot that we can understand about what's happening in those clinics inside the content of those messages. And so as we took, the million messages that were sent about food across all our organizations, we then realized within those messages, we have a lot of insights, because some messages we will know through the content that that clinic is addressing food through a pantry versus this clinic is addressing food by helping people enroll in SNAP, or this clinic is addressing food by implementing a food as medicine type of program. And so it led to us taking a lot of the segmented content and leveraging AI as well to once again pass that unique content and synthesize sort of the ways and approaches that different organizations are solving these very complex problems like food and housing, but also going into other areas like cancer screenings or chronic disease management. And so this leads us to start to understand the different segments of what's happening in the messages specific to free clinics. We went and we took only the free clinic data because we wanted to make sure that the insights about free clinics weren't lost in the larger data set of all CareMessage customers. And this is sort of a distribution, and I tried to use, some of the color coding as sort of a heat map on some of the highest performing messages or the highest trending topics of certain messages within the pillar of access to care. So within access to care, when we think of the journey to access to care, we usually start, at the top, thinking about, whether people have access to health insurance, and or, in the case of a lot of you, you might have some kind of service eligibility. You're helping patients screen due to their income. Sometimes you actually, the services you provide might only apply if they don't have health insurance. And so we sort of start there with the screening. Then we go into what we call appointment offerings, which is, some of you might have wait lists. Some of you send out notifications of the times your clinic is open. And then a large portion of you are definitely leveraging our entire appointment lifecycle messaging, from appointment reminders, follow-ups if patients cancel and trying to get them to reschedule, to post-appointment messaging, whether that's a follow-up to no-shows or patient satisfaction surveys. And so the appointment lifecycle is certainly the highest trending topic in our access to care vertical, followed by administrative notices, clinic closures, weather events, other transitions that you might have for staff if providers are joining or departing. So that's the second highest trending topic within the access to care vertical. And then the third highest one is clinic events. So a lot of you are hosting community health fairs, or you might be hosting other events. Mass vaccination events tend to show up in this category as well. We have a few other areas that are sent through our system, including clinic classes. That might be, you have a very specific diabetes class or chronic disease management class. Medication reminders, somebody's due for medication refill, or sometimes you all send those notices right before a hurricane is coming, and you're letting people know, hey, make sure you get your medication ahead of time, or your insulin. And then medication assistance tends to be more of the prescription assistance programs, whether that's supporting people in applying for them or renewing those. And then, less frequently, we see other types of messages around lab reminders or referrals. But this is all the breadth within the access to care category. We'll go into some of these topics more deeply in a few slides with some example messages. In the clinical outcomes space, we have about 1.3 million messages that have been sent around clinical outcomes. And this really covers the breadth from starting with prevention to screening to management and wellness. What I will say, in looking at the data that we saw for free clinics and in comparison to the rest of our CareMessage customers, is that our free and charitable clinics are really investing a lot in prevention And in other cases, even with screenings, you all are going broader than what we tend to see in other parts of healthcare. And I have this as a call out at the beginning, or sorry, at the end of the presentation as one of our key insights, because to me that speaks to a few things. One being that if we remove the pressures of healthcare billing that a lot of other parts of the healthcare system has, we are able to then invest in more of the root problems. So getting at nutrition, at exercise, at the prevention category. And then on the screening side, free clinics are going into other areas that we don't see sometimes in other parts of healthcare, because you're not driven by the incentive or the quality measures that say, you focus on just breast, cervical, and colorectal cancer. The volume of messages we found within free clinics on prostate cancer was greater than the volume we found with our community health centers. And when you compare the patient volumes, the volume of patients see at free clinics that are using CareMessage is much, much lower than the volume seen at community health centers on the CareMessage platform. So to me, that again really spoke to free clinics going above and beyond and really centering their priorities on what's most needed in the community. And when you remove that, kind of healthcare billing and profit sort of structure that exists in other parts of healthcare, it's more grounded in what communities need. So probably one of my biggest insights from this was seeing that work. And when you remove that, the limitation that healthcare has and when ends up being a focus is sort of removed. But overall, free clinics are covering a breadth of clinical areas, including chronic disease management, in the areas of diabetes, high blood pressure, high cholesterol, pregnancy and parent support as well, especially with new parents, and a lot of group classes and other things that are supporting parents through those transitions. And then a lot in the realm of wellness, from annual wellness visits to behavioral health, dental health, vision. I mean, you all cover a lot of different clinical areas, which is really exciting to see because you cover a very specific segment of our healthcare safety net that is often overlooked in other parts of the healthcare system. And then the last piece is when we head into the social drivers of health. We had about 800,000 messages tied to this. Food was the number one topic in this category, but you're helping people meet a lot of these basic needs. Food, housing, and transportation being the top three on that basic needs category. You're also supporting the navigation. We saw about 150,000 messages around case management. That's the one-to-one support that you're providing to patients, separate from about 60,000 messages just on benefit applications. You're helping people apply for Medicaid. You're helping them apply for WIC or SNAP. There's a lot of support that's being provided for patients that are helping them access a lot of other needs. And then separately, a small but growing volume of needs assessments. So SDOH type of surveys is something that you could do on CareMessage, but some of our clinics are leaving it as simple as a single message that just says, do you need help with food, housing, transportation? Text yes, and allowing that to start a conversation with their patient populations. And then the last piece is just awareness of resources. And what I love about this data is that a lot of our clinics are not waiting to run a screening to send a resource. And they're not waiting for a patient to say, hey, I need help with X resource, to just get the information out there. Most of what we saw in this category was a lot of those community-based organizations that you all probably have partnerships with are coming into the fold. And so we see it in, for example, in the financial inclusion category, seeing the messages that are going out where some of you are partnering with your local credit union and having them come in and do sessions with your patients around how to apply for a mortgage or how to save money. I mean, there's a lot of different things that are debt management was another trending topic within financial inclusion, but a lot of that creativity of leveraging other local organizations to help, patients access other resources without the patient needing to ask for it explicitly or without you waiting for a patient to express that need. We saw the same with a variety of messages around digital access, whether it's helping people get access to internet access in their home, broadband access, mobile devices, computers, on the education front, ESL classes, GED classes, I mean, a breadth of things that are being provided. And then within resource distribution, one of the key things that I saw here that I found to be really interesting was how a lot of you are stepping in, especially after natural disasters, and being a linkage for your community. So we saw, people checking in with patients after hurricanes, helping connect them with resources for furniture, for clothing, for a lot of really basic needs. And so you all play a really great role in recovery efforts within your communities and just getting resources, the quick and efficiency of getting resources into the hands of your communities is really, really great. And two other kind of lower categories in this area were both job placement and legal services, but some topics there as well. So we're going to dive into some of these interesting use cases and unique approaches that we saw specifically for free clinics to these different types of problems. So I'm going to go back into the access to care category here. And, again, we're looking at the appointment life cycle, and you're really supporting the entirety of it from that service eligibility, letting people know that they have an upcoming renewal and how to get prepared. We have some clinics that send out links with the information. Maybe sometimes it's a link to their website that lists out the different types of materials that are necessary for a patient to complete a service eligibility. Later this year on the CareMessage platform, for those of you that use it, you also will be able to start to leverage multimedia messaging to have patients send in potentially, a copy of an income statement or a copy of a bill, things that we sometimes see, a patient shows up at the clinic and forgot a single document. We're working on ways that we make that process easier for you so that you're collecting that information. But even absent of these new functionalities, a lot of you are leveraging our platform to let patients know, one, that they have that renewal coming up, and then what they should be preparing to ensure that that renewal is completed. A lot of clinics are also sending out information about appointment availability, and that might be because you have a specific service that you're offering that might be new, like a behavioral health appointments. Or sometimes those of you that have mobile clinics are leveraging it to send out information to say, hey, our mobile clinic will be at this location at this time. And that may be to either prompt patients to come in for a walk-in appointment or to text back and book an appointment. Some of you also handle wait lists or have sometimes long wait lists of people that want to receive your services. So some of our clinics are leveraging the platform to also send out notices to patients that are on that wait list to ask them, you still want to stay on the wait list, or, the spot is available, and helping them come in for their first appointment. A lot of you are using us for your regular, appointment status information. So confirmations that your appointment's been booked, collecting responses, following up on cancellations, or supporting rescheduling. If you're on the Athena Health EHR and you don't have our integration yet, please get in touch with us because we do have that available if you're part of the Athena Gives program. We have the ability to integrate and automate a lot of that appointment life cycle messaging, both to send the reminders, get those patient responses back into the EHR, follow up with those that have been non-responsive. All that is integrated. And then from there, we're also able to automate what's our newer post-appointment messaging, which is basically based on the attendance of the patient. We can either follow up with those that no show, or those that do attend, we can automatically send out a patient satisfaction survey. So for those of you on the Athena Health EHR, something to consider if you're part of the Athena Gives program, that you have access to this integration completely for free. And hopefully we're making our way to work through Practice Fusion to hopefully have that level of parity on integration capabilities, but a lot in the appointment lifecycle messaging. And this, I wanted to bring just an example of what this looks like in practice in terms of a specific message that one of our free clinics is sending. This is going out to patients that have canceled their appointment. And this is providing an opportunity for them to start to collect some information about the why. So they have patients texting in, A, if it was they canceled due to work, B for transportation, C for childcare, D for lack of, reminder, did not know about the appointment, E for others. This gives a great opportunity for the clinic to start to collect, these insights and start to make some decisions, whether that's on potential expansion of services or additional services that they could offer back to patients. But I wanted to pull this in just as an example of something that we saw within one of our free clinics, and something that also, if you have that automation on post-appointment messaging, you can embed some of this in that no-show follow-up as well to collect some information from no-shows on why they weren't able to attend their appointment. One of the other areas that I was referencing earlier is some of those time-sensitive notices and alerts. So, those clinic notices are the second highest trending topic in access to care, after appointment lifecycle messaging. A lot of our clinics are using it for things that you know of and are planned, holiday hours, closures. Sometimes you might have construction on the road and you want to let people know you might be temporarily closed. Then we have the known things, whether that's a hurricane is coming or there's a flood watch, or we see some messaging sometimes, with wildfires as well, with information on whether it's clinic time and availability or directing people to local resources. So all that is the known. And sometimes that's embedded and connected to the clinical side as well. So reminding patients to pick up their medications or how to properly store their insulin. And then we also see a lot of messaging on the unplanned, and that's, those recovery efforts, those emergency situations. The CareMessage platform is a cloud-based solution, and so it does sometimes give us the ability, if you're in a situation where you are not, on site at the clinic, or you don't have access to your CareMessage account. Those are scenarios in which our team is always happy to step in and help you get information out to your patients if that's necessary. But it's, again, you all play a very critical role in a lot of recovery efforts, and something that we are continuing to see a growing number of our clinics embed CareMessage sort of templates and communication protocols into their disaster recovery plans at the clinic, and something, for you all to consider, since we do tend to see a large portion of that coming up. And this is just an example of a message that went out last year. This was in relation to Hurricane Helene. I've redacted some information, as you'll see in these messages, just to ensure that we're respecting some of the clinic information here. But this was sent out to ask patients, if they needed help after Hurricane Helene, and letting them know that the clinic was really there to support them. It included the name of some of the staff and their phone numbers. And just that touch point, makes a very big difference to community members and how they feel cared for and listened to and connected to the clinic. So we're going to move on to the clinical outcomes side, and prevention was the highest, category within clinical outcomes. And to me, again, I'm just very excited to see the focus that our free and charitable clinics have in just going beyond and addressing both community wellness and prevention. On the exercise front, a lot of you are hosting group classes, whether that's for dance, mind, body, low income, low impact, strength and conditioning. So a lot of it is very tailored, to the needs of your communities. Some of you are hosting community walking events. I see some messages where those community walking events are sometimes, walk with a doc. You have your own physicians going out into the park and having a walk with your patients, and just building that cadence and building that muscle of getting patients to focus on physical activity. That also includes a lot of information on exercise that's provided within the messages, but overall a great focus on physical activity and prevention, getting people active. On the nutrition side, probably the highest example we see here is with cooking classes and demonstrations that are often focused on, healthy meals. We also see sometimes that go into very specific, healthy cooking for diabetes, where patients are receiving, on-site classes that help them better understand how to put healthy meals together that are, low carb or high protein and are very adapted to the chronic disease management side as well. And other education that's being provided around reading food labels, drinking more water, very specific approaches and recommendations that are tied to other chronic conditions, and a growing volume of messages that are very targeted at, food as medicine programs or pharmacy, Veggie RX, food pharmacy programs, where there's sort of this concept of a prescription for food that is happening in the healthcare setting that are really connecting people with healthier foods and overall nutrition. And then the third one I wanted to highlight here is smoking cessation. Smoking, we know, is a risk factor for almost every single trending cancer category. And so investing in both smoking cessation programs as well as counseling, nicotine replacement therapy as well. Those are all being provided by our health centers as well as our free clinics as well as lung tests. So a big focus as well on that prevention around smoking cessation and how critical that is in conjunction with the exercise and nutrition to really drive prevention and outcomes. And this is an example on the prevention side for a cooking demo. So this came from one of our clinics that is having somebody on site run these classes and provide those demonstrations for patients with sample recipes and sometimes some small incentives. In this case, a gift card for attendance. But great trending topic across all our free clinics is that leveraging of in-person touch points and sometimes also virtual, I should mention. We have some clinics also running virtual cooking classes where they send the URL and the link to that, via CareMessage, but a little bit, more accessible for those who might not be able to come on site. In the topics of, sorry, go back, of cancer, you're driving a lot of great both education and screenings in these areas. So we see our clinics not only prompt patients to get screened, but providing a lot of additional education as well. In the topic of breast cancer, we see a lot of mammogram screening events as well as reminders, but some of these are, bringing people into the health center to talk about these topics and get them more familiar with what the screening process looks like, or sometimes getting them comfortable with the process itself. We see that for cervical cancer as well with, what I see referenced to as pap smear nights or women's health events where bringing patients into the clinic and then, using that opportunity to both drive education as well as, having patients rotating through running these screenings all at once in an evening. Those are really great ways that we've seen the clinics tackle and get a lot of screenings done at once. On the colorectal cancer side, similarly, a lot of screening events and reminders and education sessions on cancer prevention. This is one of the areas that you will see us on the CareMessage side develop a lot of additional content later this year. We've been spending a lot of time reading through both outbound messages and patient responses to these types of messages. And so we're trying to evolve the way that the automation pairs with the human element, the areas where your staff really helps support sometimes the automation that might happen through an engagement platform like CareMessage, but what the data is also showing is that, that isn't enough. A lot of times the screenings paired with a patient navigator that can step in and answer personal questions can be more effective than just a single, message going out. And so colorectal cancer is one where you can expect that CareMessage will have some additional engagement campaigns coming later this year because we're spending a lot of time looking at that data and really trying to increase the education that's happening. And also because we're seeing about a 2% increase year over year in colorectal cancer with younger populations that are below the national recommendations or right at the start of the national recommendations. And so the education piece, especially with identifying early symptoms or, tackling prevention through increasing fiber intake and physical activity, all that information we think is going to be really, really critical longer term to really change some of these outcomes. And then prostate cancer, I talked about this earlier, but again, we're seeing a higher volume of this type of messaging with our free clinics than any of our other customer segments. So that's a very, very exciting place to be and a lot for the rest of us to learn from what our free clinics are doing. But what's really exciting here is, the fact that you're also hosting a lot of events specifically for men in the age ranges where prostate cancer and colorectal cancer start to become more common recommendations. And so those events we believe are very critical to get that buy-in and convince men in particular to come back in for care. Some of the data I've been reading, especially on the colorectal cancer side, I mean, there's some silver linings in that some studies have shown that if you're able to convince men to get one of these screenings, they'll get the other one. So if we're able to drive that, convince somebody to get that prostate cancer exam, they might be more likely to get the colorectal cancer uh, screening as well. But in other areas, just the messaging intervention might not be enough to convince, men to come in for these. So a lot of work to be done here because these are some of the leading causes of mortality for men nationally are prostate and colorectal cancer, as well as lung cancer. And that disparity is even greater when we look at demographics for men, even greater for both Native American men as well as Black men in terms of the incidence and mortality rates. So these are two key clinical areas that we will continue to focus on. And then skin cancer, a lot of creativity with this as well, with screening events, information on early signs, and then distribution of sunscreen. I know the NAFC has a partnership, I believe, with CeraVe and events that I've seen with them promoting both skin cancer prevention as well as utilization of sunscreen. And so we continue to see that. And it's interesting because we'll hear about these things and then for us, as we're analyzing, messages, trending topics, and the content, it ends up, showing up in that analysis as well. And this is just one of the examples of one of the messages that's been sent out for prostate cancer. But again, an example of one of the clinics that is leveraging the platform, and in this case, using walk-ins as well as allowing patients to pre-register for these types of screenings. So moving on to chronic disease management, a lot of different approaches that are being taken to help patients manage diabetes and focusing on a variety of both reminders, education, and programs. On the diabetes front, a lot of educational classes and group classes that are being held, promoting A1C checkups and just getting patients back into care to get an updated A1C value, providing resources and support groups. For those of you that are leveraging, I'll go back to our integration with Athena Health. Last year, we also did release an automation that allows our system to look at some of your clinical data, help identify patients with an A1C that maybe haven't come into the clinic in the last 12 months, don't have an upcoming appointment, and we can drive engagement to those patients to get them back into care. And later this year, we're expanding that, and that you'd be able to take some of that segmented, so some of those diabetes segments to find patients that have different A1Cs in different ranges. So from pre-diabetes to diabetes in good control, diabetes that's uncontrolled, and then define the journeys you want, whether that's getting them back into care first, and then after they come back in for an appointment, we can offer one of the CareMessage diabetes health education programs that can provide some coaching for about 6 months when they're maybe between visits to help them build some of the lifestyle change and modification things that are really critical to help reduce A1C. So those of you, again, on the Athena Gives program, something to potentially consider if you're not using one of our diabetes automations. It's available to you for free and no cost with your CareMessage use. But we do see, again, a lot of the diabetes messaging happening for supporting a variety of these things that are happening at the clinics. On the high blood pressure and hypertension side, a lot of classes as well, information on self-monitoring, and a lot of free screenings that are happening at your health fairs, which is, health fairs is something that we tend to see a lot of our clinics either deliver on their own or sometimes in partnership with other community-based organizations. And then the last highest category in the chronic disease side is high cholesterol, and also, similar to the other two, chronic disease management classes and screenings are ways that the clinics are delivering this. And this is an example of one of the messages that I believe this is tied to one of those automations you have, but inviting the patient to schedule their next diabetes management appointment to get that updated A1C. In this case, they actually are sending a link to a video from the CDC, and then prompting the patient to either call to schedule. We give a variety of options. You can prompt patients to call to schedule. You can prompt them to text in. You can send a link, if you happen to have a self-scheduling portal, you could send a link to that as well. But this is just one of those examples is being powered through one of our automations where we find patients based on their A1C value and appointment schedule. We pair that the combination of data to send out these types of messages. And in this case, it's with a goal to get patients back into care. Now, moving on to the social drivers of health side, food access and a variety of other basic needs is the highest volume of messaging we see in this category. For food, I mentioned this earlier, but a lot of you have your own on-site pantries. One of the ones that I found to be really interesting is we have one clinic that actually uses a mobile food pantry. So they do let patients know that the mobile food pantry will be at a certain location at a certain day and time. And I imagine that is really great for, accessibility for patients who might not be able to get transportation to the clinic or to another food pantry. Just having that come to their local community is a great way to both get that key important resource out, but also remove that limitation from the transportation side to make sure people are able to get that information and that access to food. A lot of food and holiday meal giveaways. We see a lot of this for, Thanksgiving and other holidays where the clinics are distributing food, packages and things that I'm sure our patients really greatly appreciate, because a lot of those holidays are very tough, financial times for them where the budget might not make it through the end of the month. And so having that resource, I'm sure is super helpful to them. And a lot of you are also promoting, SNAP application assistance and helping patients complete those applications and get on SNAP for more long-term support on the food side. With the One Big Beautiful Bill and a lot of the requirements that will be changing next year, this is one area we're actively looking at. So if you're interested in participating in some of our user research for both Medicaid enrollment and SNAP applications, we're closely tracking some of the requirements that will be implemented and trying to think of ways that we can support patients, because a lot of this we imagine is going to be a lot of administrative things, that requirements we need to check, whether that's work requirements or other information that needs to be collected to ensure that those that are eligible are able to retain those benefits. And so something that we're keeping in mind on the CareMessage side. Looking at our other two kind of basic needs that we consider here on the housing side, similar to food, we think about these problems as like there's a one-time kind of emergency issue, and sometimes there's a chronic issue of an ongoing challenge. And so we see that reflected on housing as well, with both messaging about emergency housing and shelters, and then longer term, housing vouchers, utility assistance, disaster relief support, especially for temporary shelters. So a breadth of ways in which free clinics are helping patients meet their housing needs. And then on the transportation side, a mix of, clinic provided transportation, helping patients, sometimes covering the cost of a ride, like an Uber or Lyft ride, those shared, ride share programs, either provided by the clinic or applying to other services that might help cover the cost of that transportation. And this is an example of one of the messages for one of our clinics. It's implementing a food as medicine program where they offer healthy food boxes and fresh vegetables to patients. So great way to get information out about these programs. Sometimes we also see clinics, last minute they had a pantry and they have something left over that they don't want to go bad. And it's a quick way, on CareMessage to say, hey, we have these, claim your food bag, can you come today? Can you come in the next hour? So we see that type of messaging as well sometimes, where, you want to make sure nothing goes to waste, and it can be a quick way to get information out and sometimes get patients, through the door in the next hour to make sure everything you have available is going to somebody. On the navigation front, the level of trust patients have of your staff is really great, and where I think that level of trust is really helping them support in navigating many other complicated systems. So we see a lot of that case management and one-to-one support, where you're connecting patients with resources. Sometimes the text messages reflect that a conversation might have happened, and then you follow up via text message so that resource is on their phone. Sometimes the messaging is a follow-up, and just something like I'm checking in on this thing we talked about. But a lot of that connection that patients have with the clinic is supported. And this technology doesn't work in a vacuum. It's really meant to work hand in hand with that trust and those touch points that they have with your staff, and that's what makes a lot of this work really well. On the benefit application side, some of the clinics are hosting events where they'll host an event where somebody's coming in to help, provide education, and at an event, support everybody in applying for some type of benefit. But we also see one-to-one information as well about SNAP, utility assistance programs, just other programs that your clinics are aware of in your local community, and helping people one-on-one submit those applications or follow up on the status of those. And then lastly, needs assessments. This is an area that I think is slowly increasing, but helping, assess whether running a community needs assessment or individual assessments for patients, just understand where they might need some support with navigating, or do you have a need for food or housing or transportation? Those are quick ways that we see some of the clinics, do that. Or sometimes you have a longer form, and just sending a URL to a longer form that the clinic has is something else we've seen. But more critically, especially after natural disasters, we're seeing a lot of clinics, step in and help support some of those assessments for their community to understand what the needs are. And the benefit of text messaging is that, sometimes after natural disasters, it's really hard to get, data type of services, mobile apps and things to work. But text messaging is a very, very reliable network. It's a very reliable part of our messaging infrastructure nationally. And so those text messages tend to work and go through, even if you can't get on a phone call or access something like a mobile app. This is just an example of from a case management, perspective, a follow-up, directly to patients to see if they needed any help with applying for SNAP or food stamps, and prompting them and letting them know that there's some support available through one of the in-person events. And so I'm going to wrap up here just with a few key highlights. I've mentioned this before, but I continue to be just amazed by the work that free clinics do. You all offer a great breadth of services. And when we compare that with the volume of resources you tend to receive in comparison to other parts of healthcare, it's just really incredible, the innovation and what you all get to do with such limited resources. You do so much for your communities. You ultimately end up, delivering much more than healthcare. Your community hubs, you're going above and beyond, connecting patients with a breadth of resources, helping address all those non-medical, social needs, and doing that in a way that's very community driven and based on that trust that you have. And ultimately, I see, and what this data kind of told me, or what my key takeaway is, what could our healthcare system be if we removed, billing and insurance as the number one priority, which is what we tend to see in the majority of healthcare. And if we remove that, what do we get in return? And I think free clinics are a great example of what I think our healthcare system could be if that wasn't the core, if profits in healthcare wasn't the priority. I think more organizations would be prioritizing prevention, would be addressing the root causes of chronic diseases, and especially at a time where those rates are continuing to increase. I do hope more people see free clinics as an example for that nationally. And for us at CareMessage, we're continue to be excited to support the work of free and charitable clinics, and continue to see you all as a way that we continue to transform healthcare. And with that, we've got about 6 minutes left here. And we can move on to Q&A in case anyone has a question. Feel free to drop it into the Q&A section or in the chat. And we've got Daryl here who leads our free clinic program as well, in case you have any questions about our free clinic program. And Daryl, I'm not sure if you want to do a quick introduction to yourself while we wait to see in case anyone has any questions.
Yeah, I'd be happy to do so. And first, Cecilia, before I do that, may I say phenomenal presentation of being able to give us insights and data points of not only how free and charitable clinics are making a difference in the communities they serve, but in healthcare in general as well. So thank you for that marvelous insights. And everyone team, again, my name is Daryl Belcher. I'm the market lead with CareMessage. I had the privilege of being able to service the free and charitable clinic market nationwide, along with the tribal health organizations. And again, it is certainly a pleasure to serve you all. And if you have any other questions or you would like a very specific demonstration of the product, please feel free. You'll see my email address that is copied on the background, and I'll also include it in the chat as well. But thank you so much. And please, let's get those questions, comments, feedback, comments are all welcome.
I see one question here from Catherine about assessments. Is there a way to do more than one question in succession, or do clinics ask just one question at a time as individual outreaches? We have the ability, we have a tool that's on our administrative side that allows us to create sequential messaging, sort of surveys with branching and put, we probably would not recommend more than 10, back-to-back questions in some type of survey. But we do have the ability to do that, and we could probably follow up and send you one of our templates for, a quick 10-question SUH survey where you can shuffle around if you want to ask about food or housing or whatever you want to pick from. But one-on-one, this year in particular, because we're trying to do more messaging around SDOH, if there was something custom you would like to prepare, we're also happy to work one-on-one with you and help create a custom survey for your clinic with whatever specific questions you would like to ask. And I see a message about the presentation slides. Yes, we will send these out. And we also have all the data available on our website. We just launched our free clinic section of our website this morning, so you'll be able to find it there. But I will send a follow-up email with the slides and a link.
Awesome. Cecilia, a couple other comments. Again, no questions, but thank you so much for being able to provide the presentation. And that came in, I believe, from Emily to everyone.
I see a question of their own programs. We did just launch the ability for you to make edits to the CareMessage programs. So if you're interested in using one of our health coaching programs like diabetes, nutrition, exercise, smoking cessation, you do now have the ability in your own account to make edits to that. If you happen to have an older version of the program in your account, we may need to close that and republish the new version that you can edit. So we have the ability to do that. And then beyond that, we do have some other programs that are not listed on the UI. And so I'm happy to follow up and chat through what kind of programs you're interested in, because we are actively working on one for maternal health. And then we're also working on a colorectal cancer education program as well.
One last thing, team, don't forget to also leverage the messaging capability as far as language. We initially started with English and Spanish. Now we offer additional 60 language that you can leverage to utilize within CareMessage. So don't forget about that powerful ad as well.
And if you're using that in addition to the AI response parsing, it's able to step in and sometimes, translate, patients might be texting, and even if their language is not set to the right language, let's say Spanish, we have found the AI assistant's actually able to translate and parse that to the English equivalent. So it's able to step in even when we don't recognize the language. So some additional things that we've added in the last year or so to help ease the staff workflow, both in getting information out and then handling the inbound responses from patients as well. Great. Well, we are right at time. I will send an email later today with links to the slides, the video, and additional information. If you have any questions, feel free to get in touch with either myself or Daryl. Thank you all. Those of you that are current CareMessage customers, thank you so much for your partnership and all the great work that you do. And those of you that are not yet CareMessage customers, we hope you'll consider using our product and get in touch if you have any other questions. But hope you all have a great rest of your day. And if you'll be at the NAFC conference, stop by our booth. Dara and I will both be there. Thank you all.